Hello everyone, and welcome. I'm excited to have you here today. We'll be exploring impact and prevention insights in workplaces, focusing on occupational safety and cervical cancer. In this presentation, we'll look at how workplace safety can influence health outcomes and what we can do to prevent issues like cervical cancer. Over the next few slides, I'll guide you through key points and strategies. Let's get started. Occupational safety and health are incredibly important when it comes to preventing diseases like cervical cancer. You see, by controlling workplace risks, we can reduce exposure to harmful factors that might contribute to health issues down the line. Promoting health awareness among employees is also key because informed workers are better equipped to take preventive actions. In this presentation, I'll show you how effective safety practices, such as education programs, reducing exposure to potential hazards, and encouraging health screenings, play a vital role in preventing cervical cancer within occupational settings. These strategies not only protect individual workers, but also foster a healthier, more productive work environment. So, understanding these connections is essential as we explore how workplace interventions can make a real difference in health outcomes. Occupational safety and health, or OSH, is all about creating safe work environments and preventing illnesses and injuries that can happen on the job. It's really vital because it helps protect both the physical and mental well-being of employees. When workplaces are safe, employees can focus better and perform at their best. Plus, good OSH practices help reduce healthcare costs that come from dealing with workplace hazards. So, ensuring safety isn't just a moral obligation. It's also smart for overall productivity and cost management. As we discuss these safety principles, keep in mind how they tie into the bigger goal of building healthier, more efficient workplaces for everyone. Let's take a closer look at some workplace factors that can influence cervical cancer risk. First, exposure to industrial chemicals like solvents, hydrocarbons, and metals is common in sectors such as manufacturing, printing, labs, automotive work, and industrial cleaning. These chemicals can cause cellular changes and disrupt hormone and immune functions, which may increase cancer risk. Next, exposure to polycyclic aromatic hydrocarbons, or PAHs, and fumes is prevalent in asphalt and road work, welding, mining, factory work, and construction. PAHs are known carcinogens. They can directly influence pathways that lead to cancer development. Another important factor is second-hand tobacco smoke. You'll find this in hospitality venues, bars, casinos, nightlife spots, and restaurants. Tobacco carcinogens not only damage cells directly, but also worsen HPV persistence, making it harder for the body to clear the infection. Night shift and rotating shift work, common in healthcare, security, call centers, airlines, and factories, can also play a role. These schedules disrupt our natural circadian rhythms, which can weaken immune responses and interfere with the body's ability to clear HPV infections. High chronic work stress and psychosocial demands, think healthcare, education, hospitality, or high-pressure office roles, are also significant. Chronic stress can weaken immunity, reducing the body's capacity to fight off HPV infections effectively. Dust and particulate exposure is another concern, especially in construction, mining, industrial plants, welding, and manufacturing environments. Chronic inflammation caused by dust exposure can lead to systemic strain and negatively affect reproductive health. Jobs that involve high-contact social interactions, like hospitality, nightlife, tourism, or transient labor sectors, often carry an increased risk of HPV exposure. Plus, workers in these sectors may have less access to screening services, which is a critical issue. Speaking of access, poor workplace access to screening activities, common in shift-based jobs, long hours, informal sectors, or among uninsured workers, can delay Pap smears and HPV testing, leading to late detection and more advanced disease stages. Limited occupational health programs are another challenge, especially in small enterprises, informal sectors, or among migrant workers. Without proper health education, vaccination, and preventive services, workers are at higher risk. In summary, a combination of chemical exposures, shifts in work schedules, psychosocial stress, environmental dust, social contact patterns, and inadequate healthcare access collectively influence cervical cancer risk among working women. Recognizing these factors is essential for developing effective prevention strategies across different occupational settings. Let's talk about regulations and standards. OSH, or Occupational Safety and Health, is guided by very strict rules and standards. These are in place to ensure that employers actively work to minimize hazards in the workplace. They require companies to follow specific safety protocols and to implement health programs that protect workers. These frameworks are not just bureaucratic requirements. They are designed with the ultimate goal of reducing exposure to carcinogens and other harmful agents. By doing so, they help lower the risk of serious diseases like cervical cancer among workers. So, these regulations are really foundational in creating safer work environments and promoting overall health. They connect directly to our theme of prevention and protection in occupational health. Today, I want to talk about the importance of conducting comprehensive risk assessments in the workplace. By thoroughly evaluating potential hazards, we can identify risks like chemical exposures or ergonomic issues that might not be immediately obvious. This proactive approach is crucial because it allows us to implement mitigation strategies early on, effectively reducing the risk of workers being exposed to carcinogenic agents. Not only does this help protect their health, but it also supports early detection and prevention efforts, such as for cervical cancer. When we prioritize these assessments, we're taking concrete steps to create a safer, healthier work environment. Ultimately, this ties into our overall goal of safeguarding workers and promoting long-term well-being through proactive risk management. Cervical cancer mainly happens when there's a persistent infection with high-risk types of human papillomavirus, or HPV. This is actually the primary cause, and understanding this helps us see why prevention efforts focus on HPV vaccination and screening. But it's also important to remember that other factors can increase the risk, such as smoking, which can weaken the immune system, and immunosuppression, which makes it harder for the body to fight off infections. Prolonged exposure to occupational carcinogens, like certain chemicals in the workplace, can also play a role. This highlights why workplace safety is so crucial in reducing these risks. Now, when it comes to early cervical cancer, it's often asymptomatic, meaning women might not notice any symptoms at all. That's why regular screenings, like pap tests and HPV testing, are so vital. They can catch the disease early when it's most treatable. So, in summary, understanding these causes and risk factors helps us emphasize the importance of prevention, screening, and safe work environments in reducing the burden of cervical cancer. Now, let's talk about prevention measures for cervical cancer. One of the most effective ways is through regular screening tests like pap smears and HPV tests. These screenings help detect any abnormalities early on, which is crucial for successful treatment. Additionally, HPV vaccination plays a significant role in preventing infections that can lead to cervical cancer. Lifestyle choices also make a big difference. For instance, avoiding smoking is important because tobacco use can increase cancer risk. Practicing safe sexual behavior, such as using protection and limiting the number of sexual partners, can also reduce the risk of HPV infection. Workplace safety is another key aspect. By minimizing exposure to carcinogens and supporting health promotion initiatives, workplaces can help encourage early detection and immunization. Overall, these prevention strategies are vital in our fight against cervical cancer. By combining regular screenings, vaccinations, healthy lifestyle choices, and safe work environments, we can significantly reduce the incidence of this disease and promote women's health more broadly. Let's talk about how occupational safety can really impact cervical cancer prevention. You see, our work environments can influence modifiable risk factors, so addressing these is crucial. One of the key points is the importance of screenings and vaccinations. Regular screenings, like pap smears, help catch issues early, which is vital for effective treatment. Additionally, HPV vaccination is a powerful tool in preventing the virus that causes most cervical cancers. What's important to note is that these measures are often incorporated into occupational safety programs, making it easier for workers, especially those at higher risk, to stay protected. When workplaces prioritize health initiatives like these, it not only safeguards individual workers but also contributes to broader public health efforts. So overall, integrating screening and vaccination into occupational safety isn't just about compliance. It's about creating a proactive approach to prevent cervical cancer before it starts. That connection between workplace safety and health prevention is a key theme in our discussion today. Let's take a closer look at how the impact of occupational safety can play a significant role in cervical cancer prevention. First, the work environment itself provides a unique opportunity. It offers a structured setting where health surveillance can be systematically conducted, and awareness about cancer risks can be actively promoted. This means that workplaces can become key sites for education and early detection efforts. Next, many occupational safety programs incorporate lifestyle changes as part of their preventive strategies. These might include promoting healthier habits, such as smoking cessation, proper nutrition, or encouraging regular health checkups, all of which help reduce the risk of cervical cancer. Finally, ensuring access to essential health services within the workplace is crucial. This includes making sure employees can easily access screenings, vaccinations, and other preventive care. When these services are readily available, it greatly enhances the effectiveness of cervical cancer prevention efforts. Connecting all of these points back to our overall theme, it's clear that a comprehensive approach within occupational settings can significantly strengthen our efforts to prevent cervical cancer and promote overall health. Let's talk about the importance of educating employees about cervical cancer. When we provide information on the risks, symptoms, and preventive measures, we're empowering our team to take proactive steps towards their health. Awareness campaigns and training sessions play a crucial role here. They help reinforce the message that regular health checks are vital. By encouraging lifestyle adjustments and fostering a culture of health vigilance, we create a workplace environment where employees feel supported and informed. This not only benefits their personal well-being, but also aligns with our overall goal of promoting a healthier, more aware workforce. Remember, education is a powerful tool in preventing cervical cancer and ensuring early detection. Let's talk about the implementation of protective policies in the workplace. Developing and enforcing these policies is absolutely critical for maintaining safety. For example, banning carcinogenic substances helps prevent long-term health issues among workers. Ensuring proper ventilation is another key aspect, as it helps reduce the concentration of harmful airborne contaminants. Additionally, mandating the use of personal protective equipment, like gloves or masks, provides an extra layer of defense against potential hazards. When these policies are in place and properly enforced, they significantly reduce harmful exposures and create a safer, healthier working environment for everyone. This ties directly into our overall goal of promoting workplace safety and protecting worker health. Offering on-site or facilitated access to cervical cancer screenings really makes a difference in catching the disease early when it's most treatable. When employees have easy and convenient options to get screened, it encourages more participation and leads to earlier diagnoses. Additionally, integrating regular health checkups into occupational health services is a proactive approach. It not only helps identify potential health issues sooner, but also supports timely interventions. Overall, these strategies enhance employee well-being by making health screenings more accessible and routine. This aligns perfectly with our goal of creating healthier, more productive workplaces where prevention is prioritized. Creating a healthy work environment isn't just about managing hazards. It's also about actively promoting wellness programs. When we encourage healthy lifestyles, we're helping employees make better choices that can reduce their risk factors. Stress management is another critical aspect. It helps improve overall well-being and productivity. And let's not forget about vaccination campaigns, which play a vital role in preventing illnesses, including some types of cancer. By combining these strategies, we're taking a comprehensive approach to cancer prevention that benefits everyone. This aligns perfectly with our overall goal of fostering safer, healthier workplaces for all. Occupational safety plays a crucial role in preventing cervical cancer. By reducing exposure to harmful carcinogens in the workplace, we can significantly lower the risk factors associated with the disease. Promoting health programs and ensuring a safe environment helps employees stay healthy and aware of early detection methods. Effective policies, such as regular screenings and workplace health initiatives, are key to catching issues early and preventing serious outcomes. Employee education also makes a big difference, empowering individuals to take proactive steps for their health. When we integrate these strategies into workplace health frameworks, we not only improve employee well-being, but also create a culture of prevention. Overall, a strong focus on occupational safety is essential in our broader effort to reduce cervical cancer risk and promote healthier communities.